Good afternoon friends, you are most welcome to Think Eyes channel. Today we are going to discuss practicing anthropology and our topic is applied aspect and public health. Let us begin the topic. First heading is relationship between anthropology and public health. Public health focuses on intervention to improve community health and quality of life through the prevention and treatment of disease, through surveillance of cases and the promotion of healthy behaviors. The primary focus of anthropology is also the study of people in the group or local communities in their socio-cultural context. Therefore, the focus on community is common in both the fields. Community is the foundation where both anthropology and public health can work hand in hand. Apart from the four major branches, that is cultural anthropology, physical anthropology, prehistoric archaeology, and linguistic anthropology, medical anthropology emerged as a subdiscipline of anthropology in 1950s. Medical anthropology studies human health and disease, healthcare systems, and biocultural adaptation and has much to contribute to the areas of public health. Over the years, medical anthropology and public health have become complementary to each other and work together in various cross cutting areas of public health. Both the disciplines have tried to understand, explain diseases and illness at the community levels and attempted to combat against them. The relationship between anthropology and public health is a complex and multifaceted one. Some anthropologists work directly with or for public health projects at the macro level in the arena of international or global healthy policy and planning. Others work at the micro level in a variety of national, regional, and local grassroots text or the context. Poole and Giesler, 2005. Theoretical and methodological contributions. Anthropological theory and methods have much to offer public health in the area of translating public health knowledge into effective actions. Contributions range from basic issues of cultural sensitivity to enhance the acceptability and effectiveness of proven practices in clinical or the clinic settings of the development of policy for the provision of complex treatment regimes for emerging epidemics under conditions of inequity in access to healthcare. मैक्वीन 1999. फिर से देख लेते हैं. Anthropological theory and methods have much to offer public health in the area of translating public health knowledge into effective action. Contributions ranges from basic issues of cultural sensitivity to enhance the acceptability and effectiveness of proven practices in clinic settings to the development of policy for the provisions of complex treatment regimes for emerging epidemics under conditions of inequity in access to healthcare. McQueen 1999. Moreover, anthropologists are asking questions about the root causes of public health's toughest problems. These problems are not often amenable to study using controlled clinical trials or cross-sectional survey designs. Rather, they are dynamic, system-level problems that require field-based observation and the use of multiple methods that are both qualitative and quantitative. Medical anthropology draws upon many different theoretical approaches as medical anthropologists study the health of individuals in the background of larger social formations and how environment affects human and other species. They also study cultural norms, social institutions, political and globalization. The theoretical approaches to understanding human health are first, epidemiological or ecological approach. This approach examines the way culture and the natural environment interacts to create patterns of health or disease. Second, interpretative approach. This approach looks at the way cultures use symbolic meaning to describe and understand health and diseases. Third, critical medical anthropology, that is CMA. This approach focuses on how economics and politics affect human health. Hill et al. 1995. Anthropology has made important methodological contribution to public health, especially with regard to the use of ethnography for the systematic collection of field data, qualitative methods for the collection and analysis of descriptive, interpretative, and formative data, and the integration of qualitative and quantitative approaches. The ability to translate scientific knowledge into effective practice at the community level is the third area where anthropological approaches have much to offer public health. The development of rapid assessment technique is a prime example of anthropological contributions to the public health methodological toolkit as described by J. Beebe 1995. This is a multidisciplinary team-based approach designed to generate reasonably valid, reliable, and qualitative results within a short time frame. Rapid assessments can provide the contextual information needed to design in-depth community-level and community-based public health research and to guide decisions about implementing programs in local settings. Mishler et al. 1981. Anthropological design of public health interventions. On the basis of the above discussion, it is well evident that anthropological knowledge and understandings are essential for any public health interventions. Public health is an applied field characterized by a population-based approach to health, and statistical methods are considered to be the appropriate underlying method for the field. It is viewed as a science that seeks to intervene, control, and prevent large-scale processes that negatively affect the public's health. By these criteria, there is a strong logical parallel with anthropological principles and practices within public health. The applied tradition of anthropology mainly focuses on studying illness beliefs with the aim to contributing to health interventions. The cognitive approach is interested in revealing and describing the underlying cultural codes as the schemes that structure people's interpretations of illness. Hahn 1999. An example of anthropological interventions. Despite the call of universal access to skilled birth attendance (SBA) during pregnancy and childbirth, especially in the context of achieving UN MDG 4, United Nations Millennium Development Goals 4, that is Sustainable Development Goal, reduce child mortality rates, and MDG 5, improve maternal health, this ideal target has not been achieved by some countries of the Southeast Asia region like India, Bangladesh, and Nepal, while efforts to develop SBA, that is skilled birth attendance, in all countries must continue. It may be deemed necessary for other health workforce based in the community to attend to mothers and newborns. Among the community-based attendants, almost all countries have a long history and custom of having traditional birth attendant TBAs who are popularly known as DAIs in India. TBA, traditional birth attendants, that are DAIMA, are independent of the health systems, non-formally trained and community-based providers of care during pregnancy, childbirth, and the postnatal period. TBA, that is traditional birth attendants, or the ASHA workers or DAIs, not only play a vital role before, during, and after the childbirth, but also have socially historically defined crucial roles in a particular society which may differ from community to community. WHO, World Health Organization, has recently become aware about a debate in India which seeks to revisit the role of TBAs, traditionally birth attendants, in maternal and child health care systems under the National Rural Health Mission. It seems that while government is committed to improving skilled birth attendance, phase out of TBA, that is traditionally birth attendants, childbirth attendants, let's repeat this passage. WHO has recently become aware about a debate in India which seeks to revisit the role of TBAs in maternal and child health under the National Rural Health Mission. It seems that while government is committed to improving skilled birth attendance, phase out the TBA's role during childbirth and encourage institutional deliveries as a medium to long-term goal. The need to explore alternatives in the interim has been articulated. Since the TBAs are accessible and experience indicates that the community is utilizing their services, the challenge before us is to determine what effective role they can play in India's effort to achieve MDG 4 and 5, that is SDG 4 and 5. To do this, a deeper understanding of the interplay of sociological and anthropological factors that determine TBA actions and utilization of their services by the families become necessary. WHO 2004. Role of anthropologists as community advocates. From the above example, one can very well infer the role of the anthropologist in advocating for the TBS, traditionally birth attendants, and their crucial socio-cultural roles in a particular community which are deep rooted. At the same time, it is also their responsibility to support government policy for achieving the national goal. At this point of time, an anthropologist, through an action research, can examine role of TBS, traditionally birth attendants, with a holistic approach in their socio-cultural milieu. It is reasonable to hypothesize that a meaningful and effective intervention model can be developed to modify both supply and demand side determinants only if the social and anthropological dimension are factored into the model. It has been realized by the government and other UN agencies that only with the help of an anthropological study the desired goals could be realized in gradually phasing out TBA, traditionally birth attendants. An anthropologist can play the role of a cultural broker and help in bridging the gap between policymakers and the community. Winch et al. 2000. Similarly, there are various sensitive public health problems where the anthropological interventions are crucial in solving them. Sensitive issues like HIV or AIDS, psychiatric problems, tobacco and alcohol related problems could be easily resolved through the interventions of anthropological understandings. Every society has its own cultural beliefs, cultural practices and myths which could be handled in their own cultural context. Public health intervention should be designed keeping in mind of the grassroots realities and community perceptions. Anthropologists always advocate for bottom-up approach rather than top-down. Therefore, it is very important for the public health professionals to work hand in hand with the anthropologists for any successful public health intervention. The health programs are meant for communities and community acceptance is of utmost importance to reduce the gap between planning and implementation of the programs. Action research. Action research is a systematic form of inquiry that is collective, collaborative, self-reflective, critical and undertaken by the participants of the inquiry. Action implies that the researcher will be acting as the collector of data, the analyst, and the interpreter of results to utilize the results for policy change. Advocacy in public health. Advocacy is a process by which an individual or a large group aims to influence public policy and resources allocation decision within political, economic and social systems and institutions. Advocacy in Public health encompasses direct service to the individual or family as well as activities that promote health and access to healthcare in communities and the larger public. Anthropological evaluations of public health initiatives. By now, we have come to realize the importance of anthropological methods and principles in public health interventions. Health advocacy is a major purpose of applied anthropology. Anthropologists also work as evaluators, examining the activities of public health initiatives and the successes and failures of public health programs. Qualitative research method. One of the greatest strengths and uniqueness of anthropological evaluation is the use of qualitative research methods like focus group discussion, in-depth interviews, and participant observation to evaluate the problems and for the planning and successful implementation of health programs. The strength of qualitative research methods are that they are exploratory and flexible. The results of the qualitative survey using closed-ended questions provide public health planners and programs with information about characteristics of the population on a set of predetermined questions. Qualitative methods allow the researcher to ask questions to different people in different ways and to modify the questions and data collection methods to explore topics that were not initially deemed important. Qualitative research is a type of formative research that includes specialized techniques for obtaining in-depth responses about what people think and how they feel. It is seen as the research that seeks answer to questions in the real world. Qualitative researchers gather what they see, hear, read from people and places, from events and activities, with the purpose to learn about the community and to generate new understanding that can be used by the social world. Qualitative research has often been conducted to answer the questions why rather than what, and the purpose of qualitative research is the construction of new understanding. Mack et al. 2005. Differences between qualitative and quantitative research approaches. जनरल फ्रेमवर्क में देखेंगे तो फर्स्ट वी विल सी द क्वांटिटेटिव, देन सेकंड वी विल सी द क्वालिटेटिव. क्वांटिटेटिव seek to confirm hypotheses about phenomena. Instruments use more rigid style of eliciting and categorizing responses to questions. Use highly structured methods such as questionnaires, surveys, and structured observations. General framework by qualitative research approach. Seek to explore phenomena. Instruments use more flexible, interactive style of eliciting and categorizing responses to questions. Use semi-structured methods such as in-depth interviews, focus groups, and participant observation. Second is analytical objectives. In quantitative research approach, we will see to qualify variation, to predict causal relationships, to describe characteristics of a population. In qualitative approach, to describe variation, to describe and explain relationships, to describe individual experiences, to describe group norm. In the case of question format, quantitative approach closed-ended, and qualitative approach open-ended. In the case of data format, quantitative approach numerical based, that is obtained by assigning numerical values to responses, and qualitative approach is textual, obtained from audio tapes, video tapes, and field notes. In case of flexibility in study design, quantitative approach is based on study design is stable from beginning to end. Participant responses do not influence or determine how and which question research asks next. Participant responses do not influence or determine how and which questions researcher asks next. Study design is subject to statistical assumptions and conditions. In the case of qualitative research approach, some aspects of the study are flexible. For example, the addition, exclusion, or wording of particular interview questions. Participant responses affect how and which question researcher asks next. Study design is iterative, that is, data collection and research questions are adjusted according to what is learned. Winch et al. 2000. Types of qualitative data collection techniques. Focus group discussion FGD. In this method, the researcher brings together a small number of subjects to discuss the topic of interest. Since it is a small group of the members do not feel intimidated intimidated but can express opinions freely. Normally the discussion is tape recorded, then transcribed and analyzed. In-depth interview IDI. In-depth interviews use the same principle as a focus group, but subjects are interviewed individually, ideally in the patient's own home. Interviews in qualitative research are usually wide-ranging, probing issues in detail. Observations. Data can be collected through external observations, referred to as a non-participant observer. In this type of study, the researcher aims to become part of the population being studied so that they can develop a detailed understanding of the values and beliefs held by members of the community. Case study. This is an in-depth study of just one person, group or event. This technique is simply a description of individuals. Diary methods. The researcher keeps a personal account of daily events, feelings, discussion, interaction, etc. Role play and simulations. Participant may be asked to play a role or may be asked to observe role play, after which they are asked to rate behavior, report feelings, and predict further events. Winch et al. 2000. Example of qualitative evaluation of public health initiatives. As discussed earlier, anthropologists play important roles as evaluators, examining the activities of public health institutions and the successes and failures of public health programs. There are numerous examples across the globe as well as in the India where a particular health program has been successfully implemented due to anthropological evaluations. Example 1. Tobacco use is a major public health menace due to which about 1 million Indians die from tobacco related diseases each year in India. There are almost 275 million tobacco users in India. More than one third of adults aged 15 plus use some form of tobacco, including almost half of men, 48%, and 20% of women. Recognizing the gravity of this problem, Government of India has implemented a comprehensive tobacco control law to curb the tobacco related diseases and deaths. There are a number of policies and tobacco cessation centers set up to help the tobacco users in quitting tobacco. But in various parts of India, especially in the Northeast India, among the tribal communities, use of smokeless chewing tobacco is a socio-cultural practice and a gesture of hospitality when they receive a guest. It is well evident that in Northeast India, the prevalence of oral cancer is very high due to tobacco chewing, but knowing the facts does not solve the problems as it is a deep-rooted cultural practice. It is only through the anthropological evaluations and interventions awareness could be generated amongst the people and gradually implement the tobacco control laws, taking into considerations of the cultural context. The policymakers, the healthcare professionals, or the implementing agencies must consider and handle this problem sensitively. Tobacco Control Report 2004. Example 2. BD. BD consumption and BD production both have major public health implications. It has been recognized as hazardous occupation as it affects the user as well as the BD rollers. 800 million BDs are sold in India each year. BD industry in India is a highly unorganized sector and 98% of BDs are handmade. The industry employs mostly women 76% and children 15 to 25%. There are about 5 million BD rollers in India. Children and women BD rollers suffer from various kinds of exploitations from the employers due to being unorganized and disguised employment. There is no direct contact between the employers, that is factory owners and workers. The middlemen play an important role in lives of BD rollers on a day-to-day basis. Despite the legislation against child labor in India, children in the BD industry seems to have no justice. Majority of the BD rolling children are girls as young as 5 years who are made to stay at home and are forced to work for long hours, more than 10 hours to augment the family income. There are a number of reports, articles and studies which echo the plight of women in the BD industry. It is a well known and evidence based fact that there are gross violations of human rights in the process of BD production. Indian government has passed several legislations and policy measures aiming at improving working conditions and providing social security benefits for the welfare of BD workers. However, in reality, these policies and legislations have done very little to protect the interest of BD workers who are among the most marginalized section of society. The low wages received by BD workers push them to further poverty without any alternatives and thus putting them into a vulnerable bracket. Despite the government's efforts in rehabilitating the BD workers by providing them with safer, better, and alternative livelihoods, still home based BD production is going on increasing. Through an anthropological evaluation or study, it was found out that there are socio-cultural and religious reasons behind carrying on with this age-old occupation which is going on for generation after generation. Government is not taking culturally appropriate measures to rehabilitate these vulnerable women and children who are suffering from tremendous health consequences. Voluntary Health Association of India 2008. Anthropological critics of public health policies. Anthropological critics of public health policies. Anthropology has undergone significant theoretical and pragmatic changes over the past half century. As a discipline, anthropology has been criticized for its role in imperial conquest. During colonial times, anthropologists often accompanied colonial explorers and military in order to facilitate their work and this is often referred to as the handmaiden era in the history of anthropology. However, during the past half century, socio-cultural anthropology has turned towards a more critical, reflexive, and holistic approach. With its new critical and reflexive perspective, anthropology has a lot to contribute to the development of health policy. The field of public health and more generally policy development required research contributions from a multitude of disciplines. Campbell 2010. At times, contributors of anthropology to public health is less commonly recognized, and it seems that despite anthropology's great potential for informing health policy, its actual contribution is quite small. The reason for anthropology's minimized role in health policy development could be found in its primary methodological approach, ethnography. Many involved in the process of policy making have argued that the data generated by anthropological research is less valuable because it does not lend itself to broad scientific extrapolation as does epidemiological data. Ethnographic research involves observing and conducting interviews with a small group of people. With such small numbers, it is possible to argue that these individuals could easily be unrepresentative of the general population. According to Hahn 1999, anthropologists try to look at the world through some fundamental principles of anthropological research. Cultural relativity is the basic principle through which anthropologists try to view the world, which is precisely opposite of anthropocentrism. Cultural relativity means a particular culture evolves within its cultural context with a set of norms and values, and no culture is superior or inferior, and culture is not something absolute, but it is relative. The importance of a particular cultural idea varies from one society to another, and the ethical and moral standards are relative to what a particular society or culture believes to be good or bad, right or wrong. On the other hand, ethnocentrism looks at one's own culture as more superior to any other culture. Cultural relativism was principle in anthropological research initiated by French Bois in the beginning of 20th century. The objective of anthropological research is to understand a culture in its own context, which is influenced by the environment for a successful socio-cultural intervention. Anthropologists also believe that the human nature is also influenced by culture and environment. The anthropological theories and their analyses are especially useful in the areas of public health for various reasons. According to the ecological or evolutionary theory, the primary determinants of sickness and healing are the human adaptations to their physical surroundings. But the cultural theory views the cultural norms, values, traditions as the determining factor in health. These theories are useful in the public health settings, which help in explaining circumstances, for example, the health conditions and the problems of a particular community for which a program is being planned. Moreover, these theories can also suggest in framing effective project designs taking into consideration of the community behavior. Anthropologists in public health sector always face criticisms. Anthropologists in public sector always face criticisms despite their contributions, but it is essential to continue the collaborative work in order to influence any policy decision in public health. Anthropological inquiry has the potential to generate rich and useful information. Anthropology can influence public health policy in ways that epidemiology or other methods cannot. First, the ability to see culture in its proper context in the social world and how culture affects all research. The second, the ability to pick up on minute and seemingly irrelevant details. Third, independence from biomedical goals and hegemony allows medical anthropologists to add a critical voice to the public health discourse. And fourth, provisions of objective qualitative data in the otherwise quantitative field. At the last, we will discuss the summary. To sum up, it is not appropriate for the medical community to doubt the contributions of anthropology towards public health understanding. Many people in the fields of pure medicine and public health do not understand the potential role that anthropology could play in the development of public health policy. The distinctive characteristics of anthropology, that is, holistic perspectives, qualitative methods, critical analysis of incorporating every aspect of the culture, makes it similar to the public health policy. For an effective translation of public health knowledge into action, anthropological theory and methods are crucial. To deal with the modern global health issues, integrating anthropologists along with anthropological theories and methods is extremely important, because as the simple problems are solved, complex problems will come up. Public health alone cannot offer solutions to complex problems without a broader approach of anthropology to attain the desired universal public health goals, which are locally accepted and also sustainable. Anthropological interventions are indispensable. Thank you very much.